Hello, everyone. My name is Chidi Okoroji. I'm a nurse practitioner for Pennsylvania Adult and Teen Challenge. Our topic today is MAT. MAT is medication assisted treatment, which means the use of medication in combination with counseling and behavioral therapies to provide a whole patient approach to treatment of substance abuse disorders. And when I talk about a whole patient approach, I mean meeting the patient where they are, physically, emotionally, socially, spiritually. You want to meet them where they are at the point of wherever they are. Research has shown that substance abuse disorder can be successfully treated with combination medication and behavioral therapies, and that's what MAT provides. Counseling and behavioral therapies by law must be provided for patients on MAT. It helps to provide a safe and controlled level of medication to also overcome the use of abusing opioid. It's not just opioid, it could be alcohol too. The common misconceptions with MAT is that some people think that you were substituting one drug for another, but that's not what it is. These drugs that we use for MAT relieves the withdrawal symptoms and the psychological cravings that is caused by the chemical imbalance in your body. Research has shown that when provided at a proper dose, these medications used in MAT have no adverse effects on the person's intelligence, their mental capacity, their physical functions, or employability. With MAT, the goal of recovery is to live a self directed life, um, improve patient survival, and increase retention in treatment. MAT also decreases illicit opioid use or other criminal activities as a result of substance use disorder. MAT increases patients' ability to gain and maintain employment. It also improves bad outcomes, like for pregnant women. If they're on MAT, the child is not going to suffer a lot of adverse effect from substance use. MAT generally reduces the need for inpatient detoxifications. So I just have a diagram here on MAT, that how MAT reduces heroin overdose and death. Opioid use disorder affects at least 2 million people in the United States. Chronic exposure to opioids may cause brain abnormalities, and these abnormalities can lead to addiction and is also known as opioid use disorder. In 2013, about 1.8 million people had opioid use disorder, mainly as a result of prescription pain medications, and also about 5,017 people had opioid use disorder as a result of heroin use. In United States, opioid use crisis significantly have impacted our country, mainly due to the drastic increase in opioid use disorder and also in overdose and the death in the past 2 decades. Opioid use disorder is also a chronic neurological disease that can be treated successfully with long-term medical management, and that's what MAT is all about. Opioid dependency medications include Methadone, Buprenorphine, and Naltrexone. These medications are used to treat opioid dependency and addiction to short-acting opioids such as heroin, morphine, and codeine. And also, we also use them to treat semi-synthetic opioids like oxycodone and hydrocodone. The first one I have here is methadone. Methadone is used to treat those with confirmed diagnosis of opioid use disorder. Methadone also reduces opioid cravings and the withdrawal effects, and also it can block the effects of the other opioids. These medications can be safely taken for months, years, or even lifetime without any problem. If you're planning to stop this medication, you need to discuss with your medical provider. Methadone have proven to reduce opioid-related deaths and risks of acquiring and transmitting HIV or even hepatitis C by helping to prevent relapse. For methadone, it has to be performed in a highly structured clinic. The next one I have here is buprenorphine. Buprenorphine reduces opioid cravings and withdrawal and can block the effects of other opioids also. And they come in all different forms. We have the generic buprenorphine with naloxone, sublingual tablets. It just goes under the tongue. We have just the buprenorphine, the one that does not have the naloxone with it. It's called Subutex. We have one that just goes under the tongue. We have firms. We have buprenorphine naloxone tablets, a generic brand of Zubzov. We have all different brands. We also have extended release injection called Sublicate, which can be given every month. Buprenorphine is approved by FDA. It should be part of comprehensive treatment plan that includes counseling and other behavioral therapies to provide patients with a whole person approach. Buprenorphine offers several benefits to those with opioid dependency and to others for whom treatment in a methadone clinic is not preferred or is less convenient for them. The next one I have is Naltrexone. Naltrexone is an extended release injectable that is approved for treatment of opioid use disorder. Before using naltrexone, it is very important that we complete medical management detoxification at least 7 to 10 days before use. That means if someone is already receiving something like buprenorphine, we need to make sure that it's completed, it's out of your system before we can initiate naltrexone. Evidence show that naltrexone decreases cravings. Again, it should be part of a comprehensive management that, and psychological support for the patient. This naltrexone can also be used for alcohol dependence too. Naltrexone is used as a treatment for alcohol and opioid dependence. Naltrexone blocks the euphoric effect and feeling of intoxication. It allows people with alcohol addiction to reduce their drinking behaviors enough to remain motivated to stay in treatment, avoid relapses, and take their medications. Naltrexone blocks sedative effect of opioids. If a patient relapses on naltrexone, it prevents the feeling of them being high. Patients should avoid alcohol, sedatives, or other tranquilizers while on naltrexone. The next substance use disorder that I'll talk about here is alcohol use disorder or alcohol dependence. Alcohol use disorder affects 7.2% or 17 million adults in the United States. So this picture will show you also that about 5.7 million women and about 11.2 million men have alcohol use disorder. For adolescents aged 12 to 17, it's about 855,000 of them has alcohol use disorder, and these numbers are alarming. So we have medications that we can use for alcohol use disorder. The first one I have listed here is dalsoprim. Dalsoprim is used for chronic alcoholism. It's most effective in people who have gone through detoxification or in the initial stage of abstinence. Do not take this medication while intoxicated. Do not take it at least 12 hours after drinking alcohol. Some side effects will include nausea, vomiting, chest pain, difficulty breathing, and they may even occur as soon as 10 minutes after drinking alcohol, and it may last for more than an hour. So just things to watch for. The other medication which we can already discuss is naltrexone. Naltrexone is also used to treat alcohol dependency along with opioid dependency. It blocks the euphoric effect and feeling of intoxicated and allows people with alcohol addiction to reduce their drinking behaviors, to remain motivated and stay in treatment and prevent relapse. The other medication is Acamprosate. Acamprosate can be used for people that are in recovery who have already stopped drinking alcohol and want to avoid drinking. It prevents people from drinking alcohol, however, does not prevent the withdrawal symptoms from not drinking. We usually start on the fifth day of abstinence, reaching full effectiveness in 5 to 8 days. Side effects will include diarrhea, upset stomach, loss of appetite, anxiety, dizziness, and difficulty sleeping. So that's something to think about. Opioid overdose, OD. OD impacts the life of millions of Americans. There were almost 17,000 prescription drug overdose deaths in 2010, which almost doubled the number of similar deaths in 2001. The amount of people aged 12 and older who received treatment for heroin use during the most recent treatment in the past year has risen from 277,000 people in 2002 to 526,000 people in 2013. Opioid overdose is life threatening and requires immediate emergency attention. Being able to recognize the signs of opioid overdose is essential to saving lives. And I put in some signs of overdose to watch for. If someone becomes extremely pale, their skin is cold and clammy, the body goes limp, fingernails or leaves may be purple or blue in color, vomiting, making gargling noises, person may be unresponsive or unconscious, their breathing or their heart rate may be slow or they stop. So these could be signs that should be watching for. The next slide I have is naloxone. Naloxone is a medication for opioid overdose. Naloxone is an opioid antagonist medication that is used to reverse an opioid overdose. Naloxone is approved by FDA to prevent overdose by opioids such as heroin, morphine, and oxycodone, and even so many of them out there. It blocks opioid receptor sites, reversing the toxic effect of the overdose. Naloxone is administered when a patient is showing signs of opioid overdose. So we have to be able to recognize these signs of overdose. It could be given in different forms. The easiest way is the nasal spray. It can also be injected into the muscles under the skin or into the veins by healthcare professionals. Medication assisted treatment, MAT, is a crucial part of substance abuse recovery process. And this is something that we offer here at Pennsylvania Adult and Teen Challenge. I hope this information is useful, and thank you so much for watching, and thank you so much for your time.